Okay, the old saying is that you can't really tell the age of a person anymore by how they look in their face, but if you really want to know how old somebody is, you look at their hands. And the reason for that is in the past there were really no cosmetic treatments for the hands. And so, you know, you'd see all these beautiful women that look great, but you'd see these claws that were like eating their food. So now that's no longer true with the advent of fillers and, you know, injecting the veins with sclerotherapy and lasers to help shrink and tighten the skin. That's really not true. The only situation where that is true now is when women get the arthritis and their joints get all knotted and gnarly. So, but what we're demonstrating today is injection of the hyaluronic acid fillers into the hands to plump them out. Because particularly for super skinny people, their hands start to lose all the subcutaneous fat and the bones start to protrude out. And so we're going to show the use of hyaluronic acid in the hands. And there are different varieties of hyaluronic acid on the market. We have Restylane, we have Perlane, we have Voluma, we have Bolotero. Today we're going to use the Juvederm. And the reason I like Juvederm for this treatment, yes please. The reason I like Juvederm for this treatment is because Juvederm tends to, they call it smooth, and what that means to me is that it kind of spreads around a little bit. For years I've used Radius, which is a calcium-based product. But with this, I like it a little bit better because I think that the calcium-based product tends to stay in place a little bit more. So now what we have is we have a 25 gauge needle, and I dull the tip of it, and what that helps to do is it helps to minimize the risk of tearing or ripping through a blood vessel. And that sounds pretty traumatic, and what that leads to is it leads to blood deposition in the tissue or a bruise. So we really want to try to minimize that. And the hands are very vascular, so we really want to try to avoid that. So what I do is we just inject, and the nice thing about the hyaluronic acid products is that they do have, most of them do have a little bit of lidocaine in them. So when we inject, it actually isn't too painful. Now, how are you doing there, Arlene?
It's really not painful at all.
And you can see here, when I'm injecting, we're actually just sliding right by those blood vessels. Now, of course, this is going to be variable on each patient, and sometimes you get a little luckier than in some patients than other patients. Some people tend to just be more of a bruiser. But you can see this is just sliding in, and what we do is we just continue to fill the areas where they have the most need. And that's all there is to it. And now, in terms of aftercare treatment, sometimes we'll tell people to just sit on their hands for a little bit throughout the day. And what that does is it compresses it and causes it to spread out in an even distribution. Now you can see on this hand here, we put it in, and there's actually no bruising whatsoever. So now we'll do the other hand. And Arlene has really pretty, her hands are still pretty plump, so she's really lucky. And her hands look pretty youthful. What I'd like to do is I'd love to see her get a laser treatment to get rid of some of the brown freckling, and a laser treatment just to tighten the skin just a little bit. And maybe she doesn't have any varicose looking veins in her hands like most people do as they get older, so she's very lucky. You can see how smoothly this goes in. Very comfortable for patients. The hyaluronic acid lasts for typically about 6 to 9 months, and the more frequently that you do it, the longer it lasts. And so that's really it.
Yay.
Any questions?